Hi, OpAns wants to welcome you to our instructional video on use of our patented DBS device. That is dried biofluid specimen collection of capillary blood for subsequent analysis. Our patented DBS collection device is specifically designed to ensure that you obtain a usable specimen every time. During this instructional video, we are going to describe the collection process in detail while indicating which steps are best practices and which are procedures. But first, let's talk about what we mean by those terms. The purpose of a best practice step is to protect the collector and depositor and to facilitate the least painful specimen collection possible. Failure to follow a best practice step will not invalidate a specimen. The purpose of a procedural step is to produce a valid quantitative dried capillary blood spot specimen. Failure to follow a procedural step may yield a specimen that is only qualitative, that is not quantifiable. Each step will be labeled in the bottom right-hand corner and color-coded. Best practices will have an orange border and procedures a blue border. Now let's get started. It is best practice to always work on a clean surface. For example, you may put down a clean disposable cover or disinfect the surface prior to use with non-ethanol wipe or solution. It is important to use non-ethanol products. As the collector, you should ensure that the depositor has clean hands. For example, you may have them wash under warm water with soap or use a non-ethanol cleansing wet wipe. Do not use an expired device. This may result in a non-quantifiable specimen. As a collector, you should wear personal protective equipment. For example, you should wear clean disposable gloves with each new depositor and follow all other requirements of your organization or state. To facilitate ease of collection, it is important that the depositor have warm hands. For example, you may have them run under warm water for 3 minutes or apply a disposable warming pack. You will need to select an appropriate puncture finger and site. In order to facilitate ease of collection, the middle or ring finger is preferred. Identify a site on the palmar surface of the distal segment of the selected finger, as seen in the image here. You will need to cleanse and dry the collection site using a non-ethanol product, like an isopropyl alcohol sterile prep pad, and then allow it to air dry. Now you may puncture the site with a disposable lancet. In order to ensure ease of collection, you should puncture across the fingerprints, as seen in the image on the left, and not in the direction of the fingerprints as seen in the image on the right, although either may result in an adequate specimen. Now you will want to gently encourage blood flow. To achieve this, you may hold the hand below the elbow level or apply gentle intermittent pressure as needed to finger capillaries. You should avoid the use of strong repetitive pressure, that is milking, which causes hemolysis or tissue fluid contamination. Now, wipe away the first drop of blood using a sterile dry gauze sponge or pad. Before spotting the device, you will need to allow a large blood drop to form. It should be large enough to hang from the finger when inverted. Spot the collection device by touching one drop to each of the 3 designated circles from the front of the card device. If blood flow stops, repeat the process with a different finger site. As seen from the back of the device and viewed through the translucent layer, verify that at least 2 circles are completely filled. If less than 2 circles are filled, start the process over with the new collection card device. To the punctured collection site, apply pressure and an adhesive bandage. Dispose of the used lancet into a sharps or other container, according to your state's laws. Now, finalize the device for shipping by folding the device to cover the specimens, sealing the device in the locking foil bag with the desiccant, and applying the security seal over the opening of the foil bag. It is important to store the foil bag in a cool, dry place until shipped to the lab. It should be shipped within 7 days of collection. Complete the applicable requisition form. It must accompany the shipped specimen. Ship the collected specimen and the applicable requisition form to the lab within 7 days of collection. A summary of the best practices for capillary blood collection are provided here and is available at our website, along with a summary of the procedures for capillary blood collection. An electronic copy of the best practices and procedure summaries is available at our website or scan the QR code provided here. Thank you for your attention and for using our patented DBS collection device for your capillary blood specimen analysis needs.